Today, we're diving into the critical role that nurses play in treating osteoporosis. Let's jump right
Yeah,
in.
I'm really excited about this topic. So, what's the main takeaway from the content we're discussing today?
Well, osteoporosis is a sneaky disease. It's often called the silent thief because it can progress without any symptoms until a fracture
Exactly.
occurs. And that's why nurses play such a vital role.
Right. Because they're often the first point of contact for patients, aren't they?
Absolutely. They not only monitor medication, but also educate patients on lifestyle changes, especially regarding physical activity, which is crucial
hmm
in managing osteoporosis.
But isn't physical activity risky for people with, fragile bones?
That's a common misconception. While patients need to be cautious, appropriate physical activity can actually strengthen bones and improve balance, reducing the risk of falls and
I see.
fractures.
So, nurses have to guide patients on what exercises are safe?
Exactly. Many patients are unsure about what they can or can't do. They often ask, am I allowed to lift weights? Or should I avoid certain movements?
And I imagine that uncertainty can lead to inactivity, which isn't good either.
Precisely. Inactivity can actually worsen their condition. So, nurses need to provide clear, evidence-based guidance to help patients stay active
Right.
safely.
That makes sense. Are there any resources to help nurses with this complex task?
Yes, actually, there's a new material set that's been developed specifically for nurses. It includes guidelines, assessment tools, and tailored exercise programs for patients with osteoporosis.
Oh, great. That's fantastic. How does it help in practical terms?
Well, it allows nurses to assess a patient's functional level and bone status, categorize them into one of 6 groups, and provide
hmm
customized advice and exercises.
So, it's like having a personalized fitness plan?
Exactly. Think of it like having a tailor-made suit. It fits just right and meets your specific needs.
Nice. But do nurses have enough time during consultations to implement all this?
That's a valid concern. The material was tested in several hospitals, and while time constraints are
Yeah,
always a challenge, the structured approach actually made consultations more efficient.
interesting. So, it streamlined the process rather than adding extra work?
Exactly. And patients felt more supported and informed, which is a
Great.
win-win.
You mentioned customized exercises. Can you give an example?
Sure. The principles are strong, stable, and struck. For example, strength training to build muscle mass stability exercises to
Okay.
improve balance, and stretching to enhance flexibility and posture.
But aren't high-impact exercises risky? I mean, you wouldn't ask someone with fragile bones to run a marathon, right?
Well, of course not. It's about finding the right balance. Maybe not a marathon, but perhaps a brisk walk in the park with proper
Right.
guidance.
Got it. So, we're not turning them into Olympic athletes, just keeping them active safely.
Exactly. Each patient is unique, and the program needs to, reflect that.
That's reassuring. But I wonder, do all nurses have the necessary training to provide this specialized advice?
That's an ongoing challenge. Traditionally, nursing education hasn't focused extensively on physical activity for osteoporosis patients.
Really? Shouldn't that be a priority then? Relying solely on materials might not be enough.
You raise a good point. While the material set is a valuable resource, integrating more specialized training into nursing education would be beneficial.
Definitely. Exactly. Because the better prepared nurses are, the better care patients will receive.
Absolutely. And some organizations are starting to offer additional training courses to bridge that
Great.
gap.
That's encouraging. Switching gears a bit, how significant is the impact of osteoporosis on society?
It's actually quite substantial. Osteoporosis leads to a high number of fractures annually, resulting in significant healthcare costs and impacting
Wow.
patients' quality of life.
So, prevention and effective management are not just health priorities, but economic ones as well?
Exactly. By improving patient education and care, we can reduce fractures and associated costs.
Makes sense. It's like investing in maintenance to prevent costly repairs down the line?
That's a great analogy. Preventing fractures is far better than dealing with the aftermath both for the
Absolutely.
patient and the healthcare system.
But do patients generally comply with the medical treatment and lifestyle recommendations?
Compliance can be an issue. That's why the nurse's role in patient education is so crucial. Building a good rapport and providing clear guidance can improve adherence.
Right. It's like having a coach in your corner.
Exactly. And it's not just about telling patients what to do, but empowering them to take charge of their health.
Absolutely. That's a great approach. But sometimes patients might feel overwhelmed. How do nurses address that?
By providing empathetic support, answering questions, and breaking down information into manageable steps, nurses
Hmm.
can help alleviate patients' anxieties.
That's so important. No one likes feeling lost or scared about their health.
Exactly. And with conditions like osteoporosis, early intervention and support can make a huge difference in outcomes.
Definitely. Well, this has been a really insightful discussion.
Yeah, I'm glad we could highlight the essential role of nurses in managing osteoporosis.
Me too. Hopefully, healthcare systems will continue to support nurses with the resources and training they need.
Absolutely. After all, a well-supported nurse means better care for patients, and
Couldn't
that's what
agree
it's all
more.
about.
Well said. Thanks for sharing all this valuable information.
Thank you, and thanks to our listeners for tuning in. Stay healthy and active.
Until next time.